Dear students, welcome back. In the previous session, we have discussed about the metacarpal phalangeal joints. Now, in this session, we are going to discuss about the metacarpophalangeal joints. So, there are 5 metacarpophalangeal joints are there. Now, we are discussing about the second, third, fourth, and fifth metacarpophalangeal joints. This one here. You can see here, these are the joints. Yes, this is second, third, fourth and fifth. And the first metacarpophalangeal joints we are going to discuss in the thumb itself. So it is also having the same kind of structure as that of this metacarpophalangeal joints. Okay, so totally we are having 5 metacarpophalangeal joints. So we are discussing about this 4 metacarpophalangeal joints. So each of the 4 metacarpophalangeal joints of the fingers is composed of a convex metacarpal head proximally. So this one is the proximal and this one is distal. So here the head is convex. The head of the metacarpophalangeal joints, here you can see, so these heads are convex. Convex metacarpal head proximally and the concave base at the first phalanx distally. That is the base of the phalanges distally. These are the first phalanges of all the fingers. So the base of the phalanges is concave and head of the metacarpal is convex. Okay, and this is a synovial joint of condylar variety. Okay, normally such kind of joints is having 2 degrees of freedom, that is flexion extension and abduction adduction. Okay, here the large metacarpal head has 180 degrees of articular surface in the sagittal plane. So if you can see in the anatomical position of the hand, so it's in the sagittal position. So the head is having 180 degrees of articular surface, whereas in the coronal section, so this becomes the coronal section. So in the coronal, it is not coronal plane, so it is not that much of articular surface which is seen in the sagittal plane. Okay, so in the sagittal plane it is almost congruent. Okay, and the most of the articulating surface is seen on the anterior aspect or volar aspect. Okay, and some 20 degrees of articular surface is opposed on the base of the phalanx. Okay, so this is the how the articular surfaces which are present in the metacarpophalangeal joints. If you see the ligaments, so each joint is having the ligaments called as capsular ligament, palmar ligament, and medial and lateral collateral ligaments. Okay, so the medial and lateral ligaments are called as collateral ligaments. On the anterior aspect, this one is the dorsal aspect. On the anterior aspect, it is having palmar ligament. Normally this palmar ligament is also called as volar plate. Okay, so the metacarpophalangeal joint is surrounded by a capsule. so which is generally considered to be lax in extension. This capsule is lax in extension. Okay, so this capsular ligament is thick in front and thin in behind. This is about the capsular ligament. Coming to the medial and lateral ligaments, so these are oblique bands which are placed at the sides of the joint. Each runs downwards. So here the fibers, this one is proximal and distal, so the fibers are running downwards like this on either side and forward from the head of the metacarpal to the base of the phalanx. And these ligaments are taut in flexion and relaxed in extension. Okay, and coming to the another important ligament which is present on the volar aspect, that is Palmar ligament. This is a strong fibrocartilaginous plate which replaces the anterior part of the capsule. It is more firmly attached to the phalanx than to the metacarpal. So the volar plate is attached to the phalanx than to the head of the metacarpal. Okay. The various palmar ligaments of the metacarpophalangeal joints, so all the volar plates are joined to one another by deep transverse metacarpal ligament. So as we studied in a previous session, so there are some fibers which are attached to the deep transverse metacarpal ligament which are related to the metacarpophalangeal joints. So these are the fibers which are going to connect with this deep transverse metacarpal ligament. Okay, so all these ligaments are mainly helps in to maintain the joint stability. So the ligaments main function is to maintain joint stability. Okay, so we can see the ligaments here in this pic. Yes, so this is the volar plate. You can see here, this one is the volar plate which is thick, which is more attached to the phalanx when compared to the metacarpal. So this is the volar aspect. So it is replaced. This volar plate is replacing the anterior capsule. Okay, now we will see. So here you can see the collateral ligaments here. So these are the ligaments on one side. Okay, and now we will see this volar plate function. The volar plate of each of the metacarpophalangeal joint is unique structure that increases the joint congruence. So this volar plate increases the joint congruence, and it also provides the stability to the metacarpophalangeal joint by limiting the hyperextension. Okay, and therefore provides indirect support to the longitudinal arch. We know that this is the longitudinal arch here on the front. Okay, so this volar plate is present here. You can find this. This volar plate helps in the longitudinal arch by providing support to the metacarpophalangeal joint. Okay, so this volar plate is composed of a fibrocartilage which is attached to the base of the proximal phalanx distally, but not the metacarpal proximally. Here you'll have the check ligaments here. With this check ligaments, it is going to attach with the metacarpal. So this plate becomes membranous proximally to blend with the volar capsule that then attaches to the metacarpal head just proximal to the articular surface. The volar plate can also be visualized as a fibrocartilage impregnation of the volar portion of the capsule just superficial to the metacarpal head. The inner surface of the volar plate is effectively a continuation of the articular surface of the base of the proximal phalanx. Okay, in the metacarpophalangeal extension, the plate adds to the amount of surface in contact with the large metacarpal head. The composition of the fibrocartilaginous plate is consistent with its ability to resist both tensile stresses in restricting metacarpophalangeal hypertension as well as compressive forces needed to protect the volar articular surface of the metacarpal head from objects which can be held in the palm. Okay, the flexible attachment of the plate to the phalanx permits the plate to glide proximally down the volar surface of the metacarpal head in flexion without restricting the motion. Okay, so in addition to their connection to their respective proximal phalanges, the four volar plates and their respective capsules of the metacarpophalangeal joints of the fingers are also blended with and are interconnected superficially by the deep transverse metacarpal ligaments. So here this is the deep metacarpal transverse ligament. Okay, so these fibers are going to blend with this deep transverse metacarpal ligament. So that thing we have noted earlier. So dorsal to the deep transverse metacarpal ligament on the dorsal aspect. So if you can go to the dorsal aspect, on either side of the metacarpal head, it is having some sagittal bands. These sagittal bands are going to connect each volar plate on the dorsal aspect to the extensor digitorum communis tendon and the extensor expansion. So the sagittal bands on each side of the metacarpal head, which is going to connect the volar plate on the anterior aspect to the top of the extensor digitorum tendons as well as the extensor expansion. The main aim of or the main function of this sagittal bands is to help in stabilizing the volar plates over the four metacarpal heads. So this is the function of the volar plates. Again we will see this collateral ligaments function. So normally there are two collateral ligaments. So one is at the medial side as well as on the lateral side. And also these collateral ligaments will have two parts on each side. These two collateral ligaments will have two parts. So if you consider this one is on the lateral aspect. So on the lateral aspect, so the lateral collateral ligament is having two parts. One is the collateral ligament proper and accessory collateral ligament. So some investigators like Minani and associates quantified the length changes in the different parts of the collateral ligament at the metacarpophalangeal joint with varying degrees of motion. They found that the more dorsally located collateral ligament proper, so this one is most dorsally located ligament, was lengthened to 3 to 4 millimeters with the metacarpophalangeal joint flexion. Okay, from 0 degrees to 80 degrees. From 0 to 80 degrees, this collateral ligament proper is going to lengthen about 3 to 4 millimeters. You can see here. And in the case of accessory collateral ligament, so here you can see this ligament is shortened to 1 to 2 millimeters. Okay, and with the metacarpophalangeal joint hyperextension, so if this A diagram is considered as extension, so the accessory portion was lengthened. Here you can see this one is lengthened, whereas this collateral ligament proper is on slack. So tension in the collateral ligaments at full metacarpophalangeal joint flexion, the closed back position for the metacarpophalangeal joint is considered. So in this position, so already it is in closed back position. Here we can find only minimum amount of abduction and adduction is seen at the metacarpophalangeal joint in full flexion. So what are the movements which are taking place? So we have discussed that it is having 2 degrees of freedom of motion. So that means it is exhibiting flexion, extension, abduction and adduction. What are the muscles required for this? For flexion, interosseous and lumbricals helps in flexion at the MCP, but as extension by the extensors of the fingers. Whereas in the abduction, dorsal interosseous, and adduction, palmar interosseous. And a combination of circumduction is also seen at the MCP joints. So during full flexion, at this position is called as closed back position. In this position, minimum degree of abduction and adduction can be seen. Okay, these are all the studies studied by this Minami and associates. And Schultz and associates concluded that the collateral ligaments provided stability. So these collateral ligaments provided stability throughout the MCP joint range of motion, with parts of fibers taught at various points in the joint range. So it is an excellent thing in their studies that these collateral ligaments are going to help throughout the metacarpophalangeal joints. That means throughout some range, some of the fibers are taking part in the stability of the metacarpophalangeal joints during the full range of motion. Okay, and in this study they have attributed that limitation of abduction and adduction in metacarpophalangeal flexion to collateral ligamentous tension. They proposed that the bicondylar shape of the volar surface of the metacarpal head resulted in a bony block at about 70 degrees of metacarpophalangeal joint flexion. Okay, and other studies that Fisher and associates completed a series of dissections of fingers, and they have given an explanation for relatively small incidence of osteoarthritis in metacarpophalangeal joints in comparison with the fairly common changes seen in the distal interphalangeal joints, to a lesser extent in the proximal interphalangeal joints. They found fibrocartilage that projected into the metacarpophalangeal, proximal interphalangeal and distal interphalangeal joints from the inner surface of the dorsally located extensor hood, from the volar plates and from the collateral ligaments. The fibrocartilage projections were most impressive in the metacarpophalangeal joints and may, like the volar plate itself, increase the surface area on the small base of the phalange for contact with the large metacarpal heads. So this can be, so these people, this Fisher and associates, they have seen some differences between normal joints as well as osteoarthritic joints in the metacarpophalangeal joints, and they have compared with the same joints which are present in that person. That same joints are the interphalangeal and the interphalangeal joints with that of the metacarpophalangeal joints. So these are the studies. So whatever the studies they have studied, finally all these studies shown that these ligaments provide stability throughout the joint range of motion, and also this volar plate is going to check the hyperextension of the metacarpophalangeal joints, and also it increases the surface area for the articulation of the metacarpophalangeal joints. Okay, so now we are going to see the range of motion of the metacarpophalangeal joints. The total range of motion available at the metacarpophalangeal joints, which are going to vary at each finger. Okay, so flexion extension increases radially to the ulnar. So this is the medial side, that is the ulnar aspect. If you can see, the range of motion of the flexion and extension is increasing from radial to ulnar. Okay, so with the index finger, which is having approximately 90 degrees of metacarpophalangeal joint flexion, if you can see this angle at the little finger, it is having 110 degrees of range of motion. And hyperextension is consistent between fingers but varies widely among individuals. The range of passive hyperextension is used as a measure of generalized body flexibility. The range of abduction and adduction is maximal in metacarpophalangeal joints during extension, whereas minimal during flexion. So metacarpophalangeal joints, when it is flexed, the abduction and adduction is minimal. And if you see this index and little fingers is having more frontal mobility than the middle and the ring fingers. Okay, so abduction and adduction is restricted in the metacarpophalangeal joint during flexion. And also passive rotation of the metacarpophalangeal joints has been measured, which supports that this mobility allows for adaptation of grasp for different size objects. So these are all about the range of motions of the metacarpophalangeal joint. Okay, these are all about the metacarpophalangeal joints in related to the hand complex. In the next session, we are going to see the interphalangeal joints of the fingers. Thank you.